Difference between HIV fever and normal fever. Fever is a common symptom that can arise from various causes, ranging from viral and bacterial infections to inflammatory conditions. Individuals living with HIV, however, may experience fevers in a distinctive manner due to the impact of the virus on the immune system. This video aims to delineate the key differences between fevers associated with HIV and those considered normal fevers. 1. Cause. HIV fever in individuals with HIV is not directly caused by the virus itself. Instead, it often arises as a consequence of opportunistic infections or complications related to the compromised immune system. Normal fever are typically triggered by a variety of factors, such as viral or bacterial infections, inflammatory conditions, or non-infectious causes like exposure to excessive heat. 2. Duration. HIV fever linked to HIV-related infections may persist for an extended period, depending on the specific opportunistic infection causing the fever. Normal fever due to common illnesses generally resolve within a few days to a week as the body's immune system responds and eliminates the underlying cause. 3. Pattern of fever. HIV fever in individuals with HIV may exhibit a more erratic or chronic pattern, often recurring or lingering for an extended period, reflecting the chronic nature of some opportunistic infections. Normal fever from common illnesses often follows a more acute and self-limiting pattern, characterized by a noticeable onset, peak, and subsequent resolution. 4. Associated symptoms. HIV fever in the context of HIV is often accompanied by other symptoms related to the specific opportunistic infection, such as weight loss, fatigue, night sweats, and persistent cough. Normal fever symptoms include headache, body aches, chills, and, depending on the underlying cause, respiratory or gastrointestinal symptoms. 5. Testing and diagnosis. HIV fever. Diagnosis involves testing for both HIV and the specific opportunistic infection causing the fever. Laboratory tests, imaging studies, and clinical assessments are often required for accurate identification. Normal fever. Diagnosis involves identifying the underlying cause through physical examination, medical history, and sometimes laboratory tests, such as blood cultures or imaging. 6. Treatment. HIV fever. Treatment focuses on managing both HIV and the associated opportunistic infection. Antiretroviral therapy, ART, is crucial for managing HIV, while specific medications target the opportunistic infection. Normal fever. Treatment depends on the underlying cause and may involve antipyretic medications, antibiotics, or antiviral drugs as appropriate. 7. Lymph node enlargement. HIV fever. Swollen or enlarged lymph nodes are common in individuals with HIV, reflecting a compromised immune system and often associated with opportunistic infections. Normal fever. While some infections can cause swollen lymph nodes, it is not as consistently associated with fever in non-HIV-related cases. 8. Skin rashes. HIV fever. Opportunistic infections in individuals with HIV can lead to distinctive skin rashes, such as those associated with Kaposi's sarcoma or fungal infections. Normal fever. Skin rashes associated with common fevers are usually caused by viral infections and can present with characteristic patterns, depending on the underlying cause. Distinguishing between HIV-related fever and normal fever is crucial for accurate diagnosis and appropriate management. Individuals experiencing persistent or recurrent fevers, especially those with HIV, should seek prompt medical attention for a comprehensive evaluation and tailored treatment plan.